I show about 2012 that you had a disc protrusion at the upper or mid thoracic region, up in the upper chest, kind of in the back. And reading my notes, I took you through kind of a individualized lesson on the back pain method that I've promoted. I call it the O'Connor technique. And we used some of my equipment on the first time. You were able to get out of pain. Since 2012, what has been your experience using my technique on your upper back pain?
As long as I stay away from manual labor, I'm good. It's pretty much pain-free. I don't really have pain that much anymore.
Do you think if you hadn't been introduced to that technique, you'd be pain-free?
Probably not, because I used to do stretching before and that never helped.
Yeah.
So the techniques there were ways of stretching that I didn't know how to do.
Yeah. I had given you a referral to to a surgeon.
And I chose not to because it was simply for, I guess, surgery and fusing the discs.
Right.
I've had family members and friends that have done it and say don't do it at all.
So you avoided surgery then,
You got it.
and were able to get, I mean, you were at a state where other people known to you resorted to surgery, but you found that abhorrent. You couldn't see yourself in their shoes.
Correct.
And so over time, using my technique, you avoided the surgery.
Yes, sir.
Right. Well, that's the kind of thing that I like to hear from people. There was another question I wanted to ask. You were going to tell me what caused your back problem.
It was accumulation of things. I've been in quite a few car accidents, but I had a weight rack fall on me in weightlifting class. The floor was slippery. It slipped down, and I guess the bottom part of my back, they said it collapsed downward. And it was asymptomatic, so I didn't feel it. But that was probably the trauma that started the degeneration. And then very heavy weightlifting. I weightlifted so hard in wrong form and just, trying to show off with all the other guys, and it just deteriorated it more.
Another part of my program that differentiates it from what other conventional techniques are used for back pain is that I educate people in the mechanics of the disc. Did you find that once you understood the mechanics of the disc and how it operated and what caused the pain, you had a better understanding of how to solve that pain problem?
Yeah, you brought in actually one of the pieces that shows the spine, and you worked it around and showed me how to move the joint back into place.
And so you're now largely pain-free, occasionally you get some pain and you get out of it, or
Yeah,
what would you put yourself at right now?
Most of the time I'm pretty pain-free. It's just when I do too much lifting. I can still lift weights, but it's just too much manual labor.
Yeah.
If I'm moving furniture, that's usually when it'll bother me, something like that.
Good. Now, you don't mind me putting this on my website as a testimonial, do
Not
you?
at all.